discussing introduction and some stages and some treatment options of the glaucoma in Urdu. So today we are discussing the glaucoma in English because some person may be having the more knowledge and skill and learning on the English instead of the Urdu. So today the glaucoma, that is called the black water or the kala motia in Urdu, we will be discussing in English. So I will be having some answer regarding the queries and questions raised by the public, and the madam Dr. Seba will highlight the questions and I will give the answer. Yes, madam.
So please sir, guide us what is glaucoma and its main types.
Actually, glaucoma is the optic neuropathy. This is the nerve. This nerve is started from here and it ends here, and ultimately it drains into the brain. The glaucoma is the condition in which the pressure may be raised, intraocular pressure or intraocular pressure may be low. Any condition, the low pressure or high pressure, that is damaging this nerve. And this nerve is actually the line or the point which leads to the brain, and this is meant for the vein. If this is lost due to glaucoma, the vein will be lost. Okay, what next?
So what is the incidence of glaucoma?
Incidence depends upon many factors. The glaucoma is more common in advancing age. If the person is above 40, the chances are more. In some type of glaucoma are more in the male gender, and some types are more in the female gender. Some glaucoma types are in the children after the birth, that is called infantile glaucoma or congenital glaucoma or ophthalmos. And some types are more common in the middle age, and some may be due to the trauma, hypertension, diabetes, and the condition likewise. The family history is very important. If the person has positive family history, his parents are having the glaucoma, his offspring may have the chances of the glaucoma. So it is dependent upon the environmental, on the race, on the gender, and other condition. Hypertension is also a leading precipitating factor in causing the glaucoma. What next?
Okay sir, what is diagnosis?
Diagnosis is actually a very tricky point. You have to diagnose the glaucoma by measuring the intraocular pressure, that is called the tonometry. And tonometry again will depend upon this cornea. If some person has thick cornea, the intraocular pressure may be having the reading of high. If the intraocular pressure is low and the cornea is thin, it will show the low pressure. So the intraocular pressure may be high due to this cornea. So
Okay,
today we are thinking about the corneal thickness, number one. Number two, here is the angle structure that is measured with the gonioscopy, and at the end we are seeing through this pupil, and this nerve is studied through this pupil. This is called fundoscopy.
Yes, sir.
And then nowadays the OCT is a device that tells the structure abnormalities that are produced by the glaucoma. That is very good investigation, and this is the latest one investigation, OCT. After that, the simple question of the history as age, as early presbyopia, as family history, as trauma are very important. If we see the tonometry, we see the corneal thickness, we see the fundoscopy, we see the gonioscopy, we see and measure the visual fields, extent of the vein, where our extent of vein is in the temporal side, nasal side, up or down. We can have the aids in these. But again, the OCT is very important nowadays. This is the diagnosis. If you diagnose, you may be safe, you can preserve the vein.
Yes,
What
sir.
next?
So what should be its treatment options, or what possibly can be?
There are actually 3 treatment options after the diagnosis. One is the medical treatment, other may be the laser treatment, and the third one may be the surgical treatment. Initially, according to our these type of the glaucoma, we always start from the medical treatment. If the patient having the good compliance and he is affordable and he can have the potential to buy the drops that may have some income problem, if he or she can have the capacity to buy the drops and he has the good compliance to instill the drop 1 per day, 2 per day, 3 per day drop, then and VL feed is preserved and VN is preserved, we start with the medical treatment. If the medical treatment fails and patient has got the decreased VL feed defects and optic nerve damage, then we will shift to the patient to the surgical treatment.
Okay,
The
sir.
laser has also the effects, but the most the perfect treatment is the laser surgery.
Yes.
If the patient can afford the medical treatment, we can 1 drug, 2 drug, 3 drug, we can add up all the drugs, and patient if has the good compliance, he can be on medical treatment. Otherwise, we will shift to the surgical treatment.
Okay, sir. So now the last but not the least question, that is, what can be the visual recovery?
Visual recovery, if you diagnose the glaucoma in the early stage, as always it is said that this is the silent VN killer. VN killer, it causes the VN killer, VN decrease VN, and that depends upon many factors.
Okay.
Sometimes the patient is unavailable that he has got the decreased VN.
Yes.
As the glaucoma progresses, the VN gradually decreases. If he can be diagnosed at the early stage and can be treated medically or surgically, he or she can preserve the VL status.
Okay, sir. So please convey a public message if you want.
The public message is that every person who or she has the family history should be investigated, number one. Number two, if the patient has got the advancing age more than the 40 years, he should be investigated.
Yes.
If the patient has hypertension and diabetes, he should be investigated. And if the patient is presbyopic,
Yes.
early presbyopia means the decreased VN before 40 years, he should also be investigated.
Yes.
And this should be raised question and the information in the public that the glaucoma is the silent VN killer and it should be diagnosed earlier.
Exactly, sir.
And
Thank you so much,
thank you,
sir.
thank you so much. Thank you.